How is atrial fibrillation monitored for stroke? Imagine your heart as a busy city with many roads, and sometimes traffic can get unpredictable. Atrial fibrillation is like that unpredictable traffic, where the heart's upper chambers beat irregularly. Detecting this irregularity is key to preventing strokes. So, how do doctors keep an eye on this hidden risk? The first step often involves a standard electrocardiogram, or ECG, which is a quick test that records the heart's electrical signals. It's like taking a snapshot of your heart's rhythm at that moment. If the ECG shows irregularities, that's a clear sign. But sometimes, atrial fibrillation comes and goes, especially if it's paroxysmal, meaning it starts and stops suddenly. That's where short-term monitoring with a Holter monitor comes in. This device is worn for 24 to 48 hours and continuously records your heart rhythm. It's like having a heart diary for a couple of days, catching any irregular beats that might happen sporadically. However, because atrial fibrillation can be fleeting, longer-term monitoring often provides a better chance of detection. External event monitors or patch monitors can be worn for days or even weeks. These devices can record your heart rhythm whenever you feel symptoms or automatically if an abnormal rhythm is detected. This extended approach increases the likelihood of catching episodes that might only happen occasionally. For even more thorough monitoring, especially in patients with cryptogenic strokes, strokes with no clear cause, doctors may recommend implantable devices called insertable cardiac monitors. These tiny devices are implanted under the skin, usually in the chest area, and can monitor your heart continuously for months or even years. Think of them as a dedicated security camera for your heart. Over time, they can detect episodes of atrial fibrillation that might be very brief or asymptomatic, which traditional methods could miss. Studies have shown that these implantable monitors significantly increase the detection of atrial fibrillation, sometimes revealing episodes months after the initial stroke. Once atrial fibrillation is identified, especially if it's persistent or frequent, doctors often consider starting anticoagulant medications. These blood thinners help prevent blood clots that can cause strokes. The decision to start treatment depends on your overall risk factors, which are assessed through various scoring systems and clinical judgment. Current guidelines recommend starting with a standard ECG and short-term Holter monitoring after a stroke. If no irregularities are found but suspicion remains, longer-term external monitors or implantable devices may be used. This stepwise approach helps ensure that no episodes of atrial fibrillation go unnoticed, especially in patients with strokes of unknown cause. In summary, monitoring for atrial fibrillation involves a combination of quick initial tests and longer-term strategies. The goal is to catch even the briefest episodes so that appropriate treatment can be started to reduce the risk of future strokes. Always remember, if you or someone you know has had a stroke or is at risk, consulting a healthcare professional is essential for personalized care and the best monitoring plan.